Hey guys, welcome back to the channel. I am Dr. Dawson, and today I wanted to bring to you guys one of the cases in a story of a dog that went through a lot more than we originally thought she was going to be going through. So a little bit of backstory about me and where I practice, so some of this maybe makes a little bit more sense. So I work in a mixed animal practice in central Minnesota where we see lots and lots of different species, lots of different cases, and no offense to anybody who's living here, but it's far from a high income place where we can run every single test that we would ever desire. So this case that came in is super interesting, at least to me, because, well, we'll just tell you the story. So a dog came in to visit that we're going to call Olive. That was not her name, but for privacy's sake, that's what we're going to call her. So Olive is a little bit of an older, middle-aged dog who lives in a part of the county that is very, very high in wood ticks, that is very, very high prevalence for Lyme disease, as most of our practice area is. And Lyme disease, if you don't know anything about it, you can find out up here in the card, and there's a video about what Lyme disease is, or Borrelia burgdorferi. And she came in with some symptoms, and the majority of those symptoms were pretty non-specific. So she had a little bit of depression, she wasn't herself. She didn't want to eat, or anorexia. And she just didn't really move around a lot, which we call lethargy. And those are pretty much the signs that she came in with. Maybe a little bit of limping, but it was hard for the owner to describe it. So she came in, and obviously because of the history of her having had ticks on her in the past, we wanted to run a 40X test. Now, a 40X test is a test that we use to test for heartworm and also 3 tick-borne diseases: anaplasmosis, Lyme disease, and Ehrlichia. All 3 of those are spread by ticks. Mostly we see anaplasmosis and Lyme disease in our area. And then we also wanted to run a CBC and a chemistry. Now, I wanted to run this because she also had a couple other things that were a little bit off to me, and I wanted to make sure that if we did have a positive Lyme test, that there was something else to back that up. Because about 70% of dogs, maybe 60% of dogs that come into our clinic and get tested probably test positive, somewhere in that range. It's a really, really high percentage. And of that, only a small percentage are actually going to show disease or clinical disease from that. That means that they were infected and they were able to overcome it. Now, Olive, I wanted to make sure, one, that her liver and her kidneys were functioning normally, because it was kind of a little bit of a slower onset than I would typically expect from Lyme disease, and there wasn't the typical symptom of limping, at least not obvious limping. So, ran the CBC and chemistry. Chemistry came back almost perfectly normal, and the CBC came back with some elevated neutrophils. Now, neutrophils are a type of white blood cell that the body uses with acute, meaning sudden, inflammation. And the body uses neutrophils, and this goes for most mammalian species, the body uses neutrophils to control sudden inflammation, typically associated with some sort of infection, whether it be parasitic, whether it be viral, or sometimes even bacterial, probably most often bacterial. So we saw a neutrophilia, and this kind of confirmed what I had been suspecting, that, most likely she had Lyme disease. Now, not everything fit perfectly, but there was enough evidence that there was nothing else wrong on physical exam. Nothing was abnormal. I didn't find any spots. I didn't find any joint disease. Palpating her abdomen, everything felt normal. Her teeth, gums, eyes, everything looked really normal. She was well hydrated, and there wasn't a lot for us to go on. And so, being where we are in the country and the number of animals that come in with some sort of tick-borne disease, that seemed to be the most likely culprit, and so that's what we started to treat for. Now, when we treat for Lyme disease, our typical protocol is doxycycline, which some people may have had as an antibiotic as well, but we do it for 30 days because it's so hard of a bacteria to kill. The other thing that we'll typically do is an anti-inflammatory, and the one that I usually will reach for, especially in dogs like her where I have a current blood panel and says her kidneys and liver are doing great, is carprofen. And carprofen is a specific type of anti-inflammatory that we use in dogs that functions essentially like Advil or ibuprofen in people. She did great over the weekend, and then the owner called me up, hey doc, she's got this weird bump and spot on her side. Is that something the antibiotics do? No, not really, not normal. Let's bring her in, let's take a look at the lump, let's see what's going on. Well, I think it might be a tick bite. It just is really red and inflamed, but I think there might be like a tick head in there. Okay, sounds good, bring him in. So we bring Olive in, and Olive looks pretty normal, happy. Obviously between the antibiotics and the carprofen, she is doing fantastic. At least she's feeling better. So start doing an exam, look at this spot. Now it's about 1 inch in diameter, so it's a pretty large red, very inflamed area. And within that is a little bit of a raised spot, and it feels very fluidy, so something like an abscess. And now I didn't take any pictures beforehand. Once I saw this, I started feeling around even a little bit more, and I felt something that was a little bit hard. And at this point, I'd almost given up, saying, well, let's just lance it and call it a day, or maybe let's just leave it and see how it resolves. But feeling this hard thing, something told me that it wasn't right, that we needed to do a little bit more digging. So I felt around a little bit more and went out and talked to the owner and said, hey, this is what I found. I think we should probably do at least a local block. So doing some lidocaine so she can't feel it, and let's lance this and make sure that we get whatever's in there out, and then she'll heal up a lot quicker. So go ahead, she said, go ahead, it's great. So I did that. So we did a local block with some lidocaine, and she didn't really feel anything while we were doing this. And I am preparing to just basically lance and flush an abscess, which many people love to watch on YouTube, but I don't have video of this one, unfortunately. I really, really wish I would have filmed this. So I cut it open, and there's some abscess material, which was pretty expected, and I'm digging around for whatever this hard thing was. Grab my forceps or a hemostat, and I pull, and I get a hold of it, and I pull it out and pull it out and pull it out and pull it out and pull it out, and out comes this wooden stick that's 10 centimeters long. Now granted, how this was positioned, it had to have been in her abdomen. How, I don't know. This was the only mark on her body. I checked the rest of her abdomen, the other side, everywhere else that I could on her body, and there was no evidence of an entry point. So what I suspect is that this stick had been in there for probably weeks, if not months, with a very, very small entry wound that would have been no more than a scab. And the body had just started trying to work it out with a lot of inflammation, a lot of abscess, and weakening of the skin so that it can push it out. So us pulling it out probably saved her life in some ways. The thing that's really amazing to me though, while that stick was in the back end of her abdomen, it didn't, or at least apparently did not puncture anything, as she's done great since we pulled it out. So who knows where this stick came from, but wherever it came from, I'm really glad that we were able to get it out. So what is my point in telling you guys this story? Well, I have 3 things that I really wanted to talk about that I think this story illustrates very well. The number one thing is diagnosing the correct thing can be extremely difficult. Your vet is very well trained and has gone through a lot of schooling to diagnose a lot of different things, but it can be very difficult to find out exactly what's going on. And in this case, with Olive, what we did was we treated what the most likely thing was first. And I think that's usually a very good approach, especially when it's so common. But what happened was we obviously missed something else major going on that probably was actually the cause of all of her symptoms in the first place. Now, how would we have been able to diagnose that? In order to probably diagnose that without finding an entry wound, I palpated her abdomen, didn't feel anything, and it's probably a good thing that I didn't press too hard, or it could have potentially caused even further issues by puncturing things. But we probably would have had to have a CT scan in order to really diagnose it. And the reason I say that is wood doesn't show up on x-rays, and it doesn't show up on ultrasound. Not very well anyway. And so we probably would have had to do a CT scan to find this stick in her abdomen without, it coming out like it did. So in some ways, we got very lucky. The second thing that I really wanted to mention is that even though that doesn't always find something specific to point to as this is the cause of your dog's disease, or doesn't find something that they were maybe looking for on blood work or on one of their diagnostics, does not mean that the diagnostic was useless. For example, in Olive's case, I looked at her liver and her kidney values, and those were the two things I really, really wanted to look at, as well as her CBC. Now, the CBC showed us something, but her chemistry really didn't show us anything other than she's normal. And that diagnosis of her kidneys and liver being within normal functional limits means that I was able to diagnose and prescribe the correct things. So I was able to prescribe the correct antibiotic and prescribe the correct anti-inflammatory that without that would have been, well, we can try this, but we may risk a lot further side effects. Because in dogs with kidney and liver disease, we really try to avoid things like carprofen because it can cause or exacerbate that kidney or liver. And the third thing that I wanted to really mention is that lots and lots of strange things happen. And as a veterinarian, you never know what's going to walk into that door. It might be as simple as a vaccine appointment, or it might be something crazy with some exotic species. But even with dogs and cats, we never know. And it's sometimes really difficult to properly diagnose what's going on because the limits are endless. There is almost no limit to the things that can walk into the door, and we're well trained on a lot of them, but there's not a single veterinarian that's going to be well versed in every single body system enough to be able to diagnose everything right 100% of the time. And keep that in mind. If your vet wants to send you to a specialist, it's not because they're incompetent, but it's because they realize, hey, this is maybe more than I'm equipped to handle best. And specialists can be very expensive, but it's something where a specialist does this kind of procedure or does this kind of diagnosis or deals with this kind of condition on an almost daily basis. In a case that I might see one of in my life, they see 2 or 3 a year. And so it really is an advantage to them when they get referred cases of, here's this, and this is something that they know how to diagnose, they've seen it, and this can really be an advantage to your pet as well, as they may need some specialized care that your general practice veterinarian may not really be well equipped for. Now, that's not to say that they may not be willing to try if they need to, because just like in this case, even though I didn't know exactly what I was getting into, I knew enough to, 1, let's prep this area so it's sterile, 2, let's flush this out and do basic wound management, and 3, we got out the apparent problem. And as of right now, she's doing great, and the wound is healing up nicely. So with Olive, everything really went well, and it's probably one of the best outcomes that we could have asked for her. I don't know where she got a stick that would be stabbed into her abdomen like that, but I'm really glad that I could be part of taking it out and taking care of her. So hopefully you guys enjoyed this video. If you guys want to hear more about some of the cases that I see on a daily basis, leave that down in the comments and I will happily oblige. Otherwise, we're going to be going back to rabbit content here in the next couple of weeks. I've got a few more rabbit videos planned, and then we'll probably actually soon after that be talking a little bit about veterinary lifestyle. What is it like to be a veterinarian? What are some of the challenges that I deal with every day? And what are some of the financial aspects of being a veterinarian? Do I make the most money out of anybody? Or am I poorer than dirt? You've probably heard both, and we're going to talk about that pretty soon. So you guys have a good rest of your day, and we'll see you in the next one.